Good afternoon, everyone. I am Khaled Bin Yusuf, working from Nari Maitree, Bangladesh. From Nari Maitree, we're working from the CFCF round, Strategic Partnership round 10, 11, 12, and now we are very honored to work to be a part of the fast track to cure initiatives. So we are here to discuss the incredible breakthrough of BPaLM, the short all-oral DRTB regimen, but a medical breakthrough is only complete when it's available, accessible, and acceptable to every person, that's those who need it. So here, my presentation, Data by the People, Community Monitoring for Equitable Drug, is about ensuring the shortest cure leads to the shortest path, and we achieve this by empowering the community to be the system's accountability partners. So the conflict of interest, I have no conflict of interest to report. So the DRTB context in Bangladesh, the seventh globally high burden countries of the world among the 30 countries, and also the MDRTB rate is much higher than the other countries. So in last year, 2023, and also in the new report of the WHO 2024, 0.3 million people TB cases identified, and among them the most problematic things is only the 2 in 5 people with drug-resistant TB are diagnosed and treated. So among 7,000 people, we have only 2,729 people that has been diagnosed by the DRTB. So this is a very much needed because we are working with the TB Alliance with this project particularly to focusing the 1 million people who are mainly facing the high stigma and misinformation. So as the the community peoples are so much vulnerable due to the stigma, and also that's why due to these barriers they have made the starting the BPaLM treatment delay. And we have last year we have prepared the TB legal environment and human rights scorecard with the CFCS 12 round. And with this TB legal human rights scorecard, we have identified some gaps that's mainly properly for find out the non-discrimination and access to comprehensive support in here. So this is why community data matters. When the legal framework is weak, when we found this, so the people themselves must become the human rights monitors to ensure the new treatments that's the accessible equitability. So with this FTCC cure, we are mainly focusing on the accountability, that's empowering the community to monitor the rollout. So in the last TB legal and human rights scorecard, we have find out that some gaps in our systems, like the non-discrimination, that is the stigma, and also the right to comprehensive care, that is the support service, and the accountability. So that's why we are trying to raise the community-led demand creation and monitoring to ensure that the effective BPaLM 6 months, this is the effective deployment in the areas that we are working. So there's the pictures of our community, and we have prepared some stories with the survivor and the TB champion that is disseminated to the people to make them aware about how can then increase the community demand creation. So the first one pillar is the community-led demand creation. We have prepared ambassador network, like 30 ambassador networks in the different community that is included by the TB survivors, community health workers, and the DOT providers. And we also regularly provide them support. They have make some support groups, and with this support group, we have make a linkage with them with the National NTB program. And by that, we have also prepared some ISC materials, that is the culturally appropriate messaging, video leaflet, and also some community events. So these first things increase the awareness and demand to the community that are working. That is our first pillar for making this possible. And these things, like we have also created some making referral loops with these ambassadors who are working with us. So we make a structured referral system that is linkage with particularly the local health facilities. And also we are quarterly, regularly trying to track the number of the individuals that is referred to the TB services and the give exposure to our awareness campaign. So with this all efforts, we find out that the informed demand reduces the loss to follow-up and measurable service is uptaken by this community. By the second pillar is the core mechanism where we community scorecard, we like approaching this process like there is the data collection first, then the scoring, and then there is some dialogue with the community people. Then there is some joint planning and action plan up with the NTB for the sustainability. And then we regularly follow up these things, because without the follow up, this is not possible to regularly find out the things that what is happening here. So we have find here that the stigma-free care that whether the does counseling respect the patient's dignity, also the psychosocial support is available, and the accountability. And with these things, the impact is that we provide the data pinpoints for the legal human rights scorecards. Standards are failing to local level. So this is the case study. So with this, all of the study, we have regularly meet with the National TV program, and the scorecards with these districts was find the challenge that the new regimens, the stigma-related dropouts, and the need on the ongoing psychosocial support for the BPaLM patients. So with this support, the 30 ambassadors network that is we have established, that is the with collaborative support with the NTP, and also with this support, NTP recently updated the national guideline that officially began the nationwide 6-month oral regimen, and the health worker also get the treatment. So that's why they provide the new training curriculum that is more effective and the shorter and safer retrieving at scale. And with those ambassadors that are working, that are provide the community-based awareness, run support groups, and offer the peer groups, and also that's bridge the gap between our local health community clinics and the community, ensuring patients receive accurate information on the ongoing support they are getting. So they like these ambassadors working as a local information hubs. That's they're working to combating the misinformation and also documented the patient's experience with the BPaLM. So with this, all of the data and the decision and policy makers, we have got all the community feedback mechanism, and with the community feedback mechanism that we are collecting for the different channel like online, physical boxes, there, and also we analysis the data that we are getting from them, and also there are the individuals who get the services like diagnosis, treatment, and engage with the BPaLM ambassadors. So after that, we have making a meeting with the policy makers like NTP staffs, community leaders, and provide them the result that they want to show. And with this, now we're doing the high-level advocacy meeting, and now we're trying to doing the policy things and budget influence things. By that, the gaps that we identify, that is measurable improvement in access and accountability delivery. So in last, we can say that Nari Maitree's this model demonstrates that community monitoring anchored by the TV legal environment and human rights scorecard is the foundation for an equitable and sustainable for the DRTP response. So we have empowered the community to not only demand treatment, but to given the quality and human rights compliance. Our next step is to sustainability plan with the NTP to fully integrate this model, ensuring long-term adherence to human rights standards. So for the new cure to succeed, we must make system accountable to the people they serve. Thank you, everyone. 6 months max. So we hope to make a sustainable equitable access to everyone. Thank you, everyone.